The Knowledgeable Provider podcast is intended primarily to entertain, also to inform, but it is not a substitute for actual medical training and should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, please make an appointment to see your own knowledgeable medical provider. The opinions expressed by me and anyone else who happens to appear on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than the lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies, and I have no other relevant financial disclosures. Look, this is all for fun, okay? Don't sue me. All right, on with the show. Hello, welcome to Knowledgeable Provider. I'm your host, Jody Marks. I want to talk about a term that I've heard a lot lately. That's impostor syndrome. I think it's probably one of those things that's overused and maybe sort of, I don't want to say trendy, but just popular to use right now. It's not a new phenomenon or a new term. The term itself was actually coined back in 1978, and the idea of it is certainly not new. It just refers to someone feeling like they're not really qualified to do what they're doing. So in a medical sense, that would mean any healthcare professional in a situation that would require training, licensing, being qualified to do that particular thing. In a broader sense, I guess it would refer to really anyone who's trained to do anything. And the thought is, even with evidence to the contrary, you believe that you're not qualified to do whatever you're doing. So even though you completed the training and passed the classes and passed the certification exams and do your CEUs and renew your certifications and get hired and keep your job, have good evaluations, et cetera, you still believe that you're not supposed to be there, that someone's going to realize that you're a fraud and that you don't actually know what you're doing and you're not actually qualified to do whatever you're doing. I would guess, and I kind of hope, that anyone working in medicine, taking care of patients, has felt this way at least a little bit at some point. You know, there's just so much to learn about medicine. It's so big that no one person can ever really hold it all in their brain. And it also changes. Even if you could hold it all in your brain, it's going to be different a year from now. And so you combine that with the fact that you are making decisions that are important to people's lives, that affect people's lives. And I mean, yeah, you should feel a little bit reserved, or at least entertain the possibility that you don't know everything and that not every decision you make is the correct one. And imposter syndrome is not an actual diagnosis. I don't think you'll find it in the DSM with diagnostic criteria laid out. But I would say that, like most other psychiatric kind of disorders, it probably doesn't really rise to the level of being a problem unless it actually starts creating difficulties for a person in their daily practice. I'm just going to go down the list of some features of imposter syndrome. I would guess that most of us can relate to having a few, if not all of these things at one point or another. Inability to accept or internalize one's success. Tendency to attribute that success to luck or chance rather than a person's own ability. Difficulty accepting praise about one's intelligence or accomplishments. A discrepancy between one's self-evaluation and external evaluations. A fear of being revealed as a fraud. Tendency to recall mistakes over accomplishments. Disappointment with present accomplishments. Hesitancy taking on new challenges for fear of failure despite previous success. Making frequent comparisons to others, believing others are more accomplished. And a reluctance to disclose potential promotion until it is accomplished. I've definitely experienced most of these, and really, my point in talking about all this today is not so much to make you aware of imposter syndrome, because I assume you already are, but I think maybe it's important for us to talk about it and acknowledge it, and important for experienced people to not pretend like we've never felt this way in the interest of helping less experienced people who are still in the process of learning or getting comfortable in their fields. I started thinking about this because of a conversation in the EMS subreddit recently, where a relatively new paramedic was talking about how when he or she initially finished school and started working, they were super passionate about the job and felt super confident and competent. And now I think it's been a year or maybe a little less than a year. And they were saying how they are very paranoid that they're going to make a mistake, having all these nightmares about making mistakes. They don't feel like they know how to do anything anymore. They're super worried about doing something that's going to adversely affect a patient or kill a patient, was the term that they used actually. And it was to the point that they were actually already considering a career change, even a year or less into it. And I have to assume that there are a lot of people out there who feel that way, especially earlier in their careers. There's another thing called the Dunning-Kruger effect, which was named in the late 90s, which is the idea that often when a person is less competent in a thing, they will actually be overconfident about their ability to do that thing, or they will overestimate their ability to do that thing. And then as time goes on, as the competence rises, the confidence starts going the opposite direction. And then at some point you have this crossover where the confidence is actually lower than the competence. So there's this sort of mirror image theory that people who are very competent will actually be less confident in their abilities. And some of the people who were commenting on this discussion were bringing up this Dunning-Kruger effect to try to sort of reassure the person like, hey, you're on the undesirable side of this right now, or you were when you came out of school, where you felt super confident about everything, even though you were only minimally competent at that point. And now you're in the middle of the confidence coming down, even though the competence is probably going up. So I just wanted to bring some attention to that today and I guess testify for anybody who is stuck in that situation. I would think everyone around you knows what you're going through, has experienced it at some point. I will say for myself, I definitely had the Dunning-Kruger experience, probably more so when I finished paramedic school. Compared to nursing education, I think paramedic training really does prepare you very well for what you're going to be doing in the field. And that's not a knock on nursing education. It's just that on the nursing side, there's just such a vast range of areas that people might go into that it's impossible to teach a nursing student everything they might need to know in whatever particular area they're going to be working in, right? So we sort of aim for just the general, okay, let's just assume that these folks are going to go work on a med-surg floor, and what do they basically need to know to be competent and get through the day while they're learning the more specific aspects of whatever role they're in. And that was pretty much my experience with nurse practitioner training as well. Because again, you just have to focus on generalizable things and then know that people are going to learn the things that are specifically applicable to their specialty once they get there, which might sound scary if you're not someone who works in medicine. I would argue that that's why nurse practitioners should have to work directly under a physician, at least for a while after coming out of school. Because that's not so true for physicians, right? They go to medical school to learn all the general stuff that's always applicable, and then they do a residency where they actually work in their chosen field for a number of years. And so by the time they come out of that, they know what they're doing. I asked Dr. James about that when I interviewed him for the podcast. I think I said something along the lines of, did you feel prepared by your training when you got out in the field working? And he didn't even hesitate. He was like, oh yeah, of course. And I would guess that most new nurses and nurse practitioners would not say that, at least after a few months of being on the job. With paramedic training, of course, it's a more specific field. It's a more limited range of things that you have to teach somebody about. And there's also some pressure there to be more of an expert on what you're learning about, right? Because those people are going to be out in the field with very limited resources. And so I think there's some pressure there for a student to be very well equipped and trained once he or she gets out in the field. You really want them to know what they're doing, at least on a very basic level. And again, I'm only speaking from my personal experience and my personal training here. But I found that with EMS training, they make you an expert on the things that you are going to be called to deal with, and they don't teach you anything about anything else. So you come out of school knowing a lot about how to run a code, for instance, how to read EKGs, how to deal with heart attacks and strokes and trauma, all that stuff that you think about paramedics dealing with, and you don't know anything about anything outside of that. And I definitely remember after going through paramedic training, I felt like I got this. I know everything now. I feel like I observed that a lot in myself and in colleagues working in EMS, where we would see all these situations where we'd have to go to a physician's office or an urgent care clinic or a nursing home. And we would see all these situations where we just thought, oh, these stupid doctors and nurses, they don't know anything. How stupid can you be to do blah, 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 or to not do blah, blah, blah? And sometimes that was probably accurate, but most of the time I think it was just us not considering their perspective and not considering all of the variables that they might have been having to consider in those different situations. In other words, most of the time, I think it probably just came down to ignorance on our part. So I kind of think of my career in three distinct parts. I was a paramedic for a long time. Then I was a registered nurse. Now I'm a nurse practitioner. And I'd say the Dunning-Kruger thing was most pertinent to me when I came out of paramedic school, because you really do, like I was saying, they train you to be an expert in your field. And so when you come out of school, you think, I got this, I can handle anything, it's all good. And that does happen as you go along. You get in more and more situations where you're like, wait a minute, I'm not trained for this. Wait a minute, they didn't talk about this. Wait a minute, I don't know what to do here. I've never seen this before. And the more of those situations you see and the more you learn about what's going on in your field, the more you realize how much you don't know. Looking back now, I'd say that I mostly felt pretty confident about my training and my ability to do my job as a paramedic. I don't recall ever getting to the point where I was super paranoid that I was going to make a mistake. And Lord knows I made a ton of mistakes. But I don't think that ever rose to the level where it impaired my ability to function and make a decision. When I transitioned into nursing, I would say that just felt so overwhelming from the beginning that I never really had a moment of thinking, okay, I'm ready now. It's just so broad and there's so much to try to take in. And you see such different things in all the different areas that you rotate through as a student. I don't think I ever felt comfortable there at the beginning. I went to work initially in the pediatric ICU, and I know I didn't feel comfortable there really ever. I mean, I think I did a decent job and did what I was supposed to do, but I never really got to the point where I felt like, okay, I got this. I'm ready. I only worked there for 2 years. And by the end of that 2 years, I had started to feel more comfortable, like I had learned some things. I assume if I had stuck around, I would have gotten more comfortable there. But then when I moved to PACU, I actually did feel pretty confident as a nurse in PACU, which at that point I had my couple years of ICU experience as a nurse, plus my 10, 12 years of experience as a paramedic. And a lot of PACU is just basic like airway management, monitoring for any acute complications of surgery. And I felt very comfortable with that by that point. So my time in PACU was easier as far as not just feeling like a complete idiot the whole time, as I did for a lot of my time in the PICU. I guess the most experience I really had with quote unquote imposter syndrome would be when I took over the practice of a physician. Initially, when I came out of NP school and started working for Dr. James, I was only seeing his patients. So I'd see them for their sick visits and their in between 6-month lab check kind of visits, as opposed to the full annual physical exam. And then a couple years in, 2-3 years in, maybe, one of the other doctors in our building decided to leave. And it ended up that Dr. James bought her practice and I took over her patients because his practice was pretty much full. So all those patients became only my patients. Just doing family practice was still pretty new to me. And I don't know that anything's ever felt so overwhelming to me as trying to learn everything that you have to learn to function in a primary care family practice kind of situation. And for the most part, you're not making decisions about acutely serious things. You're not generally doing things or handling things that are going to kill the patient right now. So that helps as far as just putting things in perspective. But it is so broad. You have to be prepared to talk to people about literally anything they might bring up relative to their health. And I felt very, very overwhelmed by that at first when I was doing my family practice rotations in school and when I started hanging out with Dr. James to start learning how he practiced. It really is a lot. I really felt intimidated by that. And if it wasn't for the personal relationship I had with Dr. James, there's no way I would have gone into family practice in the first place. I think I would have been going back to the hospital to try to do something in the acute care realm. Of course, then you have the other aspect of I'm a nurse practitioner and I'm taking over all these patients who are used to seeing a physician. So that creates some built-in feelings of inadequacy right there. And then just knowing that you're being appraised and evaluated by all these new patients who are trying to decide whether they want to stay with you or not can feel pretty intimidating. I think we took over her practice in 2020, right as COVID was getting started. So that means now I've been seeing those patients for 4 years. And I am at a point now where I feel very comfortable with that. I think all the ones who didn't like me for whatever reason are now gone. So I feel comfortable with the role and the job and with patients, and they feel comfortable with me. And so I'm not like dreading going to work every day. I'm not worried all the time that I'm going to make a bad decision. But there probably was some of that initially. And so really what I want people to hear today from this is just that if you're feeling like you're an imposter, if you're feeling like you're not good enough, if you're feeling like you can't handle it, you're definitely not alone. Probably all the people in your cohort at your same level of experience and training, wherever you are in that, have experienced that to some degree, and probably more than a few are struggling. And I want you to hear that that just happens to everybody. We all experience that. Even me now as a, I would say, seasoned, experienced clinician, I have doubts all the time about whether or not I'm doing the right thing or whether I know enough or whether I'm smart enough. I end up referring patients to specialists. And so I just assume that every oncologist and neurosurgeon and cardiologist and all the other ologists that we send people to are way smarter than I am and are just going to scoff when they read my notes or immediately go, why is this patient here? Why the heck did this dumb nurse practitioner send you over to my office when I make those referrals? And I've never gotten that feedback. All I've ever gotten really is positive feedback from patients and from specialists. Never really had a bad interaction with a consultant, either through patients or through documentation or when I've had to speak with them directly about a situation. So there's no empirical evidence that I'm not doing a good job. There's no empirical evidence that I don't know what I'm doing. But things still happen all the time to make you question that. We just recently, this past week, had a patient die that we were in the middle of trying to figure out what was going on with him. He clearly had some kind of debilitating neuromuscular disorder, and it got really bad maybe a year or two ago, and then kind of went into remission, got better. And so at that point, I think he sort of stopped pursuing, trying to figure out what had happened and just sort of went back to his life. And then it happened again. He became debilitated. And it was a situation where he was very ataxic, very weak. You could see actual muscle atrophy in his extremities. He certainly couldn't continue to do his job. He had to go out on extended leave, short-term disability, that sort of thing. And I felt like nobody but us really took the situation seriously. He was hospitalized 2 or 3 times, either admitted or just seen in the emergency room. And for whatever reason, everybody would take one look at him and go, oh, alcoholic, that's your problem. But as far as I can tell, unless he just consistently lied to me for the whole, 2-3 years that we saw him, I don't think that was it. I don't think he was even a heavy drinker, and I definitely don't think that whatever his problem was caused by alcohol. But he would come in pretty much unable to walk, atrocious labs, just all out of whack. And I suppose I can understand why you might, at a glance, think that he looked like somebody who might be an alcoholic, and that was the problem. But knowing him like I did, I just don't think that was it. I don't think anybody ever really took it seriously. The last time that he went to the emergency room, they very literally blew him off. He came in because he couldn't walk. They did basic labs, saw that his electrolytes were screwed up. They essentially gave him a banana bag and sent him home. Didn't let him see a neurologist, didn't really pursue the situation at all. That was maybe a week or two before the last time that I saw him. Came into our office, looked terrible, couldn't walk, incredibly weak, absent reflexes, visible muscle atrophy, terrible labs. He had seen one neurologist at one point and was very unhappy with the evaluation, didn't feel like they were on the right track. And I didn't feel like they were on the right track either from reading their note. And then he just didn't like the person so much that he just never went back. So at some point we had referred him to a new neurologist, and that appointment was upcoming. I think maybe it was still a month or 2 out when the symptoms really came back and he got sick again. So we made a plan, checked some kind of unusual labs, or unusual for us at least, to try to help rule out like myasthenia gravis and Lambert-Eaton. And so we were trying. We had a plan in progress, in motion. And then he died. I don't really know the details, but it sounds like he went into cardiac arrest at home and was transported by EMS to the ER, but never successfully revived. And that's a bit of a gut punch. That sort of thing doesn't happen so much in our realm, just because we are a family practice kind of clinic. If something's acutely wrong with you, you don't need to come to us. You need to go to the emergency room. But it still feels like a big failure. Just looking back through the chart and the records and whatnot, I feel like I did everything I could have to try to help him. So I'm not devastated by that. Throughout my career, I've always found that as long as I feel like I did a decent job and did everything I was supposed to do, it doesn't tend to devastate me when patients die. And so this is not an incident that makes me feel like an imposter per se, but it's just hard when that sort of thing happens. It takes a minute to process. So now I'm just going to go down this list of symptoms that I read earlier and talk about how I have or have not experienced that. Maybe that would be helpful to hear for somebody. I definitely have some trouble accepting or internalizing my own success. I have plenty of degrees on the wall and plenty of evidence around me that I'm doing well in life, but I still sort of assume that everyone around me is smarter than I am and everyone around me is more accomplished than I am, more competent than I am. Maybe I have some difficulty accepting praise. I probably crave that too much. My amateur psychology theory about that is I was raised as an only child, and I normally did well at things, whether that was academics or sports or music or whatever. Pretty much everything I ever got into, I did well at. And I was always very loved and praised. Everything I did was just the best thing in the world. And I think I got so used to that I sort of look for that even now as a grown adult. And if people are not praising me, I'm always thinking, what am I doing wrong? Why don't they like me? What am I screwing up? What are they saying about me behind my back? So I do still have some of that need for reassurance. If anything, I might be too much the other way, where I not only accept praise of my intelligence or accomplishments, but I feel validated by it. Like, yeah, I know I'm amazing. I'm glad that you think so too. I would never say that out loud other than right now, I suppose. But if anything, I probably seek that out too much or wish for that too much. I would say I'm harder on myself than other people are on me. I think I will always find every reason to question a decision or feel like I did something wrong, even though I never really get any negative feedback from anyone. I don't think I fear being revealed as a fraud. At this point in my career, I can tell myself, look, you have the experience, you have the training, you have the knowledge, you're doing fine, it's all right. And when I do have doubts, I guess really what I think is, well, if I'm not qualified enough for this, then so be it. What else can I do at this point? I definitely tend to recall mistakes over accomplishments. I think I've talked about before when I was talking about people asking, what's the worst thing you've ever seen? Really, the only things I remember are the sad things and the tragedies and the situations where I couldn't do anything to help. I know there have been situations where I've done well, where I have done things that had a positive impact on people. And I'm sure if you had a spreadsheet of every encounter and every decision that I've ever made, the vast majority would be on the good side, the positive side, but that's not what I remember. I only remember the mistakes. I only remember the missteps and bad outcomes. So that one is certainly very accurate for me. I don't know that I'm disappointed with present accomplishments. I probably always have been in the past, but at this point I am in a situation where things are just going great. I look around and everything's stable and everything's fine and seem to be winning at life in general. So I wouldn't say that I'm disappointed with present accomplishments. There is part of my brain that's always sort of thinking, well, what's the next step? Are we going to do this forever? Is this the last change? What's coming next? And it's been a little bit hard to shut that off in my current situation, which as far as I know is going to be the forever situation until I retire. Although if anyone out there is looking to pay, $250,000 for an excellent nurse practitioner, I'm not saying that I'm never leaving my current job. Never say never, right? I might be hesitant to take on new challenges for fear of failure. I don't know. I think I'm hesitant to take on new challenges more just because I don't want one more thing to have to do. And really, I would say a lot of my hesitancy in that neighborhood is more due to kind of social anxiety or fear of being looked down on or people thinking that I suck more than it is actually fearing any sort of failure. I recently joined the choir at church. This is like 2 or 3 weeks ago that I started going to choir practice and singing with the choir. And I love to sing. If you've looked at my YouTube channel at all, now most of it is this podcast, but there's also a playlist of songs that I've recorded and sung. I just enjoy doing that. It's not something that I've ever really studied or had a ton of training for. I wouldn't say that I'm especially qualified to sing in a choir, but our church is wonderful and accepting and encouraging. And they're just like, yeah, come on. If you want to sing, come sing with us. And it's been a lovely experience so far. Everybody there has been lovely. I haven't been asked to leave yet, so I guess that means I'm doing okay. Last week at choir practice, several people were not there who are like the stronger voices in my section. So I kind of didn't have somebody else that I could just listen to and copy what they were doing. And it was a bit of a disaster. I realized how much I don't know about singing in a choir and trying to find my part. So I guess I'm at the beginning of the Dunning-Kruger effect on that one. So I will step out and try something new, although it took me a long time to decide to do that and actually commit to it. I definitely have a tendency to believe that everybody around me is more accomplished and more intelligent than I am. I always assume that everybody else is completely confident and knows what's going on, and I'm the only one who is uncertain or afraid or whatever the situation might be. I'm not a genius, but I think I'm fairly intelligent. Maybe sometimes I'm the smartest person in the room, but I would never, ever think that. I always think everybody else here knows what's going on and I'm an idiot. Or I look around and think, oh, all these people certainly make more money than I do. All these people have accomplished more things than I have. So that is my default setting of thinking that I'm inferior and everybody else around me is doing better. And I don't think I have a reluctance to disclose potential promotion. I'm in a situation now where there's nothing to be promoted to. So that hasn't really been a thing for me for a long time. And actually, come to think of it, I've mostly always been in situations where promotion was not really a thing. At PMCID, there are a handful of supervisor positions, mostly people don't leave those positions, and so there was really no immediate hope of being promoted to anything when I worked there. At the hospital, I guess you could be a charge nurse or a supervisor, but I learned real quickly that I don't want to be in charge of anything at the hospital ever, so that was not ever something that I really aspired to, and I didn't really stick around long enough in any one position to even start considering that sort of thing. So I don't know that I've ever really been in a situation where there were a bunch of thoughts of being promoted to anything, but I don't think that's something that I would intentionally keep quiet. I tend to be pretty open about whatever's going on in my life, even though I'm not super talkative. If someone asks me a question, I generally will answer it honestly. I'm not one for obfuscating or trying to keep things hidden. So yeah, if this was a list of DSM diagnostic criteria, I might meet the criteria for imposter syndrome, but DSM always has that little caveat of this is causing a problem in someone's life. It's a big issue for them. And I would say that's not me. So hopefully that's true for everybody else as well, even though we all have these occasional doubts, occasional insecurities. Hopefully it doesn't rise to the point for most of us where it impairs our ability to do our jobs. I responded to that person in the Reddit conversation, and one of the things I pointed out was that at a certain point, anxiety and indecision and uncertainty will bring your performance down. At some point you have to quit fretting about it and make a decision and do something. I love the term analysis paralysis. I can't remember where I heard that initially. I heard somebody saying that and I thought, oh, that's fantastic. Where you worry about or overthink so much that you can't stop doing that and just take an action, make a decision. And in medicine, really in any capacity where you're tasked with using your brain and making decisions about taking care of patients, at some point you do have to put aside all of the uncertainties and all of the bad possibilities and all the risk-benefit analysis and just do something. And I think if you're overly concerned, if you're overly insecure, overly paranoid, it's going to impair your ability to do that. And if you're working in a situation like EMS, where you really need to be able to recognize serious things and do something to treat them right now, you definitely don't want to be sitting on your hands fretting about doing something when really you're losing your opportunity to help as the seconds tick by. I can think of one specific example of that from my experience. I had a person that had crashed an ATV, like a four-wheeler kind of thing. I believe it rolled over on him. And to look at him, actually would have thought he was fine. He was joking around and nice. But for whatever reason, I think perhaps he had some substances on board that were impairing his pain perception. But in reality, really his whole rib cage was crushed. I don't remember the exact number, but after we got him to the hospital, we learned that he had every rib was broken in multiple places. Like it was really a big deal. And he had developed a pneumothorax. And we picked up on that in the field. I think we noticed that he did not have breath sounds on one side, or he had diminished breath sounds on one side. And even though he was kind of lucid and carrying on a fun, light conversation with us and joking around, he was very pale. I think probably his blood pressure was really low. Like he was sick. We could tell that he was sick, even though at a glance you might not have thought that. And at that point, we had to call and get orders from a physician to do needle decompression. And it was a fairly new procedure at that time. I don't know if I had ever even done one at that point. So we called, relayed the information, got the order to do the procedure. And then because so many of his ribs were broken, we really couldn't find the ribs to count to find the spot to do the decompression. We're feeling around and we're like, I just can't, we can't feel any ribs. They're all just floating around and moving, and we can't find the right spot to put the needle. So we elected not to do the procedure for fear of sticking the needle in the wrong place. And we got him to the hospital, and I think he recovered. I don't remember hearing that he had died or anything. But we were talking to the ER doctor who had given us the order about the situation and just said, we decided not to do that because we couldn't find the landmarks. And he said, well, I wish you would have called me back and told me that, because I would have told you to just do it anyway. Which now that I've done that a few times, I would be more comfortable trying it just by sort of guessing at where the right spot was, or estimating, I suppose I should say, where the right spot was. But what he was telling us was that the benefit of doing it really would have outweighed the risk of hitting the artery or the nerve that you worry about hitting that runs on the inferior portion of each rib, or puncturing some underlying structure. And I'm sure there have been other situations throughout the years where I could have intervened, but kind of chose not to because I wasn't as comfortable or wasn't as sure. Nothing else really jumps out of my mind. But in medicine, of course, we always have that thing hanging over our head, right? First, do no harm. We never want to do anything that hurts a patient, that causes a negative outcome. So a lot of times that, I think, should stop you from being so cavalier about doing things that you're not as comfortable with or not as sure about. So anyway, those are my thoughts about imposter syndrome. If you're a new member of your profession, if you're a student, or if you're somebody who's been doing it a long time and still struggles with self-doubt and feeling that way, just know that you're not the only one. Just know that even after years, decades of experience, a person can still feel that way. My advice is just do everything you can to make sure that you are doing a good job, keeping up with your field. Ask for feedback from people around you. Make sure you're prepared to hear it if it's negative. But as long as you're doing everything you can to keep up, and as long as you're maintaining your skills and reading and continuing your education, or if you're in school now, as long as you're studying and learning and doing everything you can to be a good student and pass the assessments, you're doing great. And you're doing just as well, if not better, than your peers. And it's going to be fine. You're going to be a great medical professional, or you are a great medical professional. And same thing to anyone else who's listening who might not work in medicine. I think the same advice applies to whatever field you're in. And if it's really a problem for you, if it's impairing you, reach out for help. Go to therapy. Talk to somebody about it. Learn some tools to help kind of manipulate your own thinking and get you back on track so that every day is not miserable and every decision doesn't feel like a huge ordeal. Because I think at the end of the day, at some point, we have to be happy with ourselves. We have to be confident enough in ourselves that we don't spend all of our waking lives second guessing ourselves and worried about what we're doing or not doing. At some point, it is okay to just enjoy your life and accept that you are good enough and go on about your business. Nobody goes into medicine because they want to hate themselves or feel bad about themselves. So don't do it. Don't let that take over your life. My little catchphrase that I use on here is always stay safe, take care of yourself, take care of your patients in that order. And I really mean that. That's one thing I've learned working in medicine for this long. If you're not in good working order yourself, it's really hard to provide the best care for other people. So just learn to believe that. You're good enough, you're smart enough, you're doing a great job, and your patients appreciate you. All right, that does it for this episode of Knowledgeable Provider. I'm your host, Jody Marks. Thank you so much for listening. Please be sure to like, subscribe, or follow on your preferred listening platform. Give us a nice 5-star rating and leave a nice review. If you'd like to help support the show, you can do that at patreon.com/knowledgeableprovider. And as always, stay safe, take care of yourself, and take care of your patients in that order.